So doctor, coming back to another question, when big complex abdominal surgery, let's think like liver का भी कुछ हिस्सा जुड़ा हुआ है, कोलन का भी कुछ गड़बड़ है, मान लीजिए पैंक्रियास भी कुछ ये ऑपरेशन का अंदर है, तो इतना बड़ा जब कॉम्प्लेक्स ऑपरेशन होता है इसमें ये रोबोटिक सर्जरी, डज इट गिव यू लाइक मोर शार्प विजन एंड फाइन कंट्रोल?
Absolutely. See, this is a subject that we discuss all the time in surgical conferences. There are some surgeries for which robotic surgery doesn't really have much of an advantage to laparoscopic surgery in terms of overall outcome.
Yeah.
But there are a number of surgeries where it has been proven in trials that robotic surgery is better in terms of diminished blood loss, early recovery, early discharge, faster return to work, and particularly in cancers, increased amount of lymph node retrieval. Lymph nodes are small structures that are around the major organs, and when there is a cancer in one organ, it tends to go to the lymph node.
And we need to remove the node sometimes.
That's right. So a radical cancer surgery involves not just removal of the organ, but also removal of the adjacent lymph nodes. And there are numerous studies which have come up in the last few years which have shown that there is an increased amount of lymph node retrieval rate with robotic surgery than with laparoscopic surgery.
Okay.
And there are some studies which have also said that the margin clearance, margin refers to the cut surfaces. You say if there is a cancer here, you got to cut it all around, right?
Okay.
So that is called margin.
Yeah.
I mean,
This
the margin has to be
small,
free of cancer, obviously.
Right.
So if the margin is positive for cancer, it's not really a complete resection. So there are some studies, particularly in esophageal cancers and in pancreas cancers, and liver cancers as well, where robotic surgery has been shown to give an increased margin clearance.
Okay.
So with robotic surgery, there is less chances of margin positivity.
Okay.
That's how we call it in medical terms, margin positivity, which is great for the patient. And that translates to decreased chance of cancer recurrence, increased disease-free survival, and increased overall survival. So there are definite benefits.
Okay.
And I mean, as I mentioned right at the beginning, the blood loss is minimal.
Okay.
We see better. 10 to 14 times magnification. We get to see things better. We know exactly where the little blood vessels
we need to reach like that.
Not that those little bleeds from those blood vessels will cause any major impact to the patient's health, but then by stopping even that kind of little bleed, by seeing better and coagulating them before they're actually cut, the trauma to the patient is much less. The dissection is much nicer. So we are able to get to planes in a much nicer fashion.
Right.
Clean dissection, to put it in simple words. As a result, the blood loss is less.
Post-operative recovery is also faster.
And the need for blood transfusion goes down dramatically.
Okay.
There are so many major resections, including cancer resections, that we have done with no blood transfusion.
Right. শুনতে অবাক লাগছে, ক্যান্সারের মতো খুব মেজর সার্জারিও রোবোটিক সার্জারির মাধ্যমে মিনিমাম রক্তপাতে ঘটছে, কোনো ব্লাড ট্রান্সফিউশনও লাগছে না।